Mental health is often discussed as if it were a matter of choice or a lack of willpower, but it is deeply rooted in the biological reality of the human brain. The brain is an organ like any other, and when it struggles to balance its chemistry or manage its electrical signals, the result is a mental health disorder. Understanding these conditions requires looking past the behavior and into the neurobiology of the invisible house where these thoughts and feelings live. Depression is one of the most common examples of this biological struggle. It is not simply sadness with a story, it is a physiological breakdown. In people with clinical depression, the brain often struggles to produce or use neurotransmitters like serotonin and dopamine, which are the chemicals responsible for stability and pleasure. Furthermore, research shows that long-term depression can lead to the physical shrinking of the hippocampus, the part of the brain responsible for memory and emotion. This is why cheering up is impossible. The brain is literally lacking the hardware to process joy at that moment. Anxiety disorders operate as a survival mechanism that has lost its sense of time. In a healthy brain, the amygdala acts as a smoke detector, alerting us to danger. In someone with generalized anxiety disorder or panic disorder, that smoke detector is screaming even when there is no fire. The body is flooded with cortisol, the stress hormone, preparing for a fight or flight response that never ends. Panic attacks are the peak of this malfunction, where the brain fires a massive false alarm, causing physical symptoms like a racing heart and shortness of breath despite the absence of a real threat. Similarly, post-traumatic stress disorder occurs when the brain fails to file a terrifying memory away into the past. Instead, the memory stays in the active folder. Because the prefrontal cortex, the rational part of the brain, cannot properly dampen the fear response from the amygdala, the individual re-experiences the trauma as if it is happening in the present. Attention deficit hyperactivity disorder and obsessive compulsive disorder are also driven by specific brain circuits. ADHD is a deficit in the brain's reward system, specifically involving a lack of dopamine in the prefrontal cortex. This makes it physically difficult to regulate focus. The brain is constantly hunting for stimulation just to reach a baseline level of functioning. On the other hand, OCD is often called the doubting disease. It involves a hyperactive loop between the orbitofrontal cortex and the caudate nucleus. When the brain detects a mistake, the signal won't turn off, forcing the person to perform a compulsion just to temporarily quiet the alarm. More severe fractures in realities, such as bipolar disorder and schizophrenia, involve even deeper shifts in chemistry. Bipolar disorder is a metabolic disturbance where the brain swings between overclocking during mania and crashing into a profound energy deficit during depression. Schizophrenia involves a fracture in how the brain gates information. An excess of dopamine in certain pathways can cause the brain to mistake internal thoughts for external voices. Other conditions, such as borderline personality disorder and dissociative identity disorder, are often survival scars. They are the brain's way of adapting to extreme emotional stress or childhood trauma. Whether the brain is fragmenting identity to protect itself or reacting with intense emotional sensitivity, these are sophisticated survival reflexes, not character flaws. The most important factual takeaway in modern neuroscience is neuroplasticity. The brain is not a static object, it is living tissue that can reorganize itself. Through medical treatment and therapeutic practices like cognitive behavioral therapy, individuals can physically strengthen the connections in their prefrontal cortex to better manage these alarms and chemical droughts. If we do not judge a person for having a broken bone or asthma, we should not judge a person whose brain is struggling to balance its own complex systems. Understanding the biology of these disorders is the first step toward a more compassionate and effective approach to mental health. Gemini said, "To understand how we treat these disorders, we have to look at how specific medications and therapies interact with the brain's physical chemistry. Treatment aims to restore balance to the invisible house by repairing the wiring or adjusting the chemical levels. Correcting the chemical drought. In depression, the primary goal is to increase the availability of neurotransmitters like serotonin. A common approach is using selective serotonin reuptake inhibitors. The fact serotonin is released by one neuron but is often quickly reabsorbed. SSRIs block this reabsorption, Moines, leaving more serotonin in the space between neurons. This allows the chemical to bind to the receiving neuron more effectively, improving mood and connection over several weeks. Managing the alarm system. For anxiety and panic disorder, treatment focuses on calming the hyperactive amygdala. While therapy teaches the prefrontal cortex to better regulate fear, medication is often used to assist. The fact. Benzodiazepines act quickly to increase the effect of GABA, a neurotransmitter that tells the brain to calm down. They act like a dimmer switch on the nervous system's alarm system. Fueling the focus in ADHD, the brain struggles to activate its reward system due to low dopamine. The fact, stimulant medications increase the levels of dopamine and norepinephrine in the prefrontal cortex. This does not make the person hyper. Rather, it brings their dopamine levels up to a functional baseline, making it easier to initiate tasks and regulate attention. Rewiring the loop. For OCD, medication like SSRIs can help reduce the frequency of intrusive thoughts. But cognitive behavioral therapy, specifically exposure and response prevention, is crucial for rewiring the brain's circuits. The fact, by preventing the compulsion when an obsessive thought occurs, the brain is forced to realize that the error signal is false. Over time, this strengthens the prefrontal cortex's ability to shut down the faulty loop, physically changing the brain's circuitry through neuroplasticity. Addressing extreme shifts. Bipolar disorder requires mood stabilizers, like lithium, which are thought to protect brain cells and regulate the electrical activity that leads to mania. Schizophrenia is treated with antipsychotics, which act as dopamine antagonists. They block dopamine receptors, preventing the neurotransmitter from overactivating the pathways that cause hallucinations and delusions.